Hey there, it's Dr. Alan Bowman from Bowman Medical Hair Transplant and Hair Loss Treatment Center. And if you've got a hair loss concern or a hair loss problem, time is not on your side. You need a hair restoration consultation. There's a lot of options out there. We're going to take you through exactly what we do here at Bowman Medical in a hair restoration consultation from start to finish, show you everything that you need to know. So stay tuned. If you've got a hair loss concern or question, you've got so many options to get information, right? You can talk to a friend or a family member, a barber or a hairstylist. You can consult with a physician, maybe your primary care doctor or a dermatologist. You can fill out a form, an online pharmacy or cloud pharmacy, or a large national clinic and talk to some sales consultant, or you can visit with a board-certified hair restoration physician. Well, today I'm going to take you through exactly what happens at a hair restoration consultation right here at Bowman Medical Group, so you can see everything from start to finish, all the evaluations, what we're going to do to measure your hair, find out about your risks and hair loss situation concerns. We're going to track your progress over time, get to the bottom of the situation, and develop an effective and really appropriate treatment plan that's personalized just for you. When you first come into the office, we're going to gather all of your medical information. So you're going to fill out our forms about your hair loss situation, as well as your medical risk factors, genetics, who in the family has hair loss. We're going to gather all of this information together before you even step foot in the hair check zone. Once you're in the hair check zone, we're going to evaluate your scalp, evaluate your hair. We're going to do some measurements, not only of the more permanent zones around the back, but the areas where you might be seeing some thinning. And we've got all kinds of tools that are available to us to evaluate and track your hair loss situation. So we're going to take some measurements, we're going to look at your scalp under the microscope and really determine what exactly is happening in each different zone. And for sure, we're going to try to figure out what you're trying to accomplish. So once we have a diagnosis and we know what you're trying to accomplish, we can put together an effective treatment plan for you. So what is that treatment plan going to encompass? We're going to take a look at your risk factors and see if we can reduce them. We're going to take a look at your genetics. We can't change those, but we know that's a risk. And then we're going to take a look at all the different types of modalities that we have: medical, non-medical, non-surgical and surgical, procedural and otherwise, to help you get to your hair restoration goals. Aside from your own medical professional taking a look at your scalp and hair loss situation and developing your treatment plan, you also have your very own patient advocate. This is the go-to person that's going to help you execute your treatment plan, to help schedule your follow-ups, and answer any of the basic questions that you might have about your hair restoration treatment plan. But truly, one of the most important things that separates a hair restoration consultation right here at Bowman Medical Group from just about anywhere else is our experience and expertise. Over 25 years and 30,000 patients treated means that we have the knowledge to help you with your hair restoration goals. So if you want to get started with the ultimate hair restoration experience, click on the links below and we'll chat today.